Good afternoon, everyone. Thank you all for joining us today. My name is Rosa Stelteri, and I'm the Knowledge Translation Manager with CanCOVID and also the speaker series moderator. And so today it's a great pleasure to welcome Dr. Christina Catley, who is a senior scientist at CIHI, and Dr. Olga Krylova, who is the program consultant at CIHI. And just to give you a little bit of a context to the presentation, the Canadian Institute for Health Information, or otherwise known as CIHI, COVID-19 intervention scan and interactive timeline helps stakeholders understand the measures that aim to reduce infection rates, improve outcomes for patients with COVID-19, and manage health workforce capacity. They include key measures from federal, provincial, and territorial governments related to case management, openings and closures, physical distancing, health workforce, health services, and travel restrictions. And so today we have Dr. Krylova and Dr. Catley here to provide us a demonstration of this work that they explore the application of these products, how they support reporting and modeling of the spread of COVID-19, and predict acute care resources required to treat patients with CIHI's COVID-19 health systems capacity planning tool. And so before I hand over the floor to our presenters, there are a few items to note. So, we welcome you to keep your camera on during the presentation, but just ask that you ensure that your microphones are on mute. And for the 10-minute question and answer period, we welcome you to answer or ask your questions, in the chat box, or you can also answer it live as you wish. And our speaker series events are all posted on YouTube in about 2 to 3 days on average. So without further ado, I will hand over the floor to our 2 presenters.
Okay, thanks very much, Rosa. Am I good? You can hear me?
Yes.
Okay, perfect. So we're very happy to be here today. So this afternoon, I'm going to start with, hopefully my scan slides will advance. Okay, so I'm going to start with a brief overview of CIHI, and then I'm going to demo our intervention timeline and our intervention scan. And then I'll pass it over to Olga, and she's going to talk to you a bit about applications. So CIHI, who are we and what do we do? CIHI is a not-for-profit organization, and our goal is to provide high-quality data and standards to deliver analytical tools that would help our users use our data and to produce reports with actionable results. Our vision is better data, better decisions, healthier Canadians. So as you can imagine, the COVID-19 pandemic brought new priorities and new challenges at CIHI. In March, whoops, I'm getting ahead of myself here. In March, the pandemic was a rapidly evolving situation, and the different provinces and territories were charting their own courses to reduce infections and to improve health outcomes. To support Canada's COVID-19 response, CIHI began tracking interventions at the provincial, territorial, and the federal level, and this resulted in 2 aligned products, our intervention timeline and our intervention scan. So the scan is shown here on the left, and it's a comprehensive Excel document, and it's really targeted at researchers, at policy analysts, and at health system planners. We started doing the scan in March, and then we made an early version available in April to any interested researchers that had contacted us. And people are still doing that. We make early versions of the scan available. And then we released it publicly in June of 2020. Over on the right, we have the intervention timeline. It's sort of aimed at a broader audience. So it's for people who want to have a high-level visual description of the data, but maybe are not interested in the details as much. And it was released in September. So we're updating both of the products regularly, and the next update is scheduled for February 18th of 2021. Oh, and I should say that both of the products are available in English and in French. So I'm going to demo the actual timeline for you. So let me just hope that if I flip over here, you'll come with me. Olga? Yes. Okay, perfect. So here is the timeline. So you can see, we can start off by choosing a jurisdiction. So I'm going to choose Ontario. And you can drill down the dates if you want to. Our latest date available right now is September 28th. That will be updated shortly. I'm going to just keep what we have, and you can also choose the different categories of interventions that you're interested in. And for now, I will keep all of them. Here we have the legend. So if you have a closed circle within an open circle, then that means it's a new intervention, and just an open circle is an easing of an intervention. And these new ones are generally going to be things that are more restrictive, so tightening of interventions. Underneath, we have the daily COVID-19 cases, and we get these from the COVID-19 Canada Open Data Working Group. You can hover over and you'll see the date and the case count underneath as we go along. So see what's happening in Canada, in Ontario. And then underneath here, you have all the intervention categories. So you can expand and see what intervention types are underneath these categories. We have tried to make this as intuitive as possible for the users, but I would encourage you, when you're sort of first becoming familiar with the tool, to come in and play around to get a sense of where we put the information. So let's just do an example. So say I was interested in knowing what happened in Ontario in terms of distancing. So to make it a little easier for you to see, I'm just going to deselect everything, and I'm going to choose distancing. Okay, now let's look down here. So for distancing, we have gatherings, and we have we don't have very much going on in this line, but working from home. So let's look at the gatherings. So the first announcement happened on March the 13th. It was made by the Chief Medical Officer of Health. It was when we had 20 daily cases in Ontario. So that seems pretty good at this point, but it was a recommendation to avoid gatherings of more than 250 people. So if we want to get the story of what happened in Ontario for gatherings, I move along the timeline, and you can see that the interventions became increasingly more restrictive until such point on June the 12th that they started to ease up. And here we were allowed to have gatherings of 10 or fewer people. And if we move along the timeline, we can see that there were quite a number of easing interventions. And I know that because it's that open circle, until we come in here on September the 18th, and we have new gathering restrictions for Toronto, Ottawa, and Peel. And since then, because we've been doing the scan, and it's become increasingly restrictive. We also have a lot of interventions pertaining to what has been done specifically for the health workforce. I'm going to show you some of those. Expand here. Okay. For example, change in practice. So this could be things like healthcare professionals doing things that they were not previously authorized to do. I'm not going to try to say this word, NASA, no, I don't know, but be able to do like swabs of the nose, I think, or down over here, guidance for safe testing for pharmacists if they're going to be doing COVID-19 testing. We also have interventions related to license reinstatement, safety guidelines, and also supply management. So this would be things like what happening in hospitals, allowing people to postpone non-urgent services. For whatever province or territory you've chosen, you also have the ability to look at what was going on at the federal level at that time. So if we go down here, you can see we can expand Canada. And there are a lot of interventions in Canada, particularly pertaining to health workforce regulations. And also you can see a lot going on in terms of travel restrictions, particularly at the start of the pandemic. Here's when travel advisory against all non-essential travel outside of Canada was issued on March the 14th. And if I wanted to learn more about this particular intervention, you see the number in the middle there under the scan ID, CAN028. I would use that number to go to the comprehensive Excel scan, which we can link to at the bottom here. And I could learn more about that particular entry ID, because in order to display this visually, we obviously had to make some like decisions about how long the text could be that we could put in these short descriptions. So the comprehensive scan gives more information. Once you've selected everything you're interested in, if you want to, you can come up to the top and you can export a CSV of your data and then have that in your own Excel format. Okay, so now I'm going to show you a bit more about the actual Excel scan. As you can see, it's an Excel spreadsheet, so you can drill down and filter to the intervention categories and types you're interested in. I'm just going to blow this up so you can see it a little bit better. So first of all, we have this unique entry ID. So that matches to that scan ID that you saw in the timeline I just showed you. You have the jurisdiction. So this can be the province, territory, or Canada. The date that the intervention was announced and the date that was actually implemented on. They're often the same, but not always. These are all categorized by intervention category. And there are some categories that we have in the comprehensive scan that are not in the timeline. For instance, quite a bit of information pertaining to financial interventions that we decided, just for sake of like the space we had, not to put in the interactive tool. And then most of our interventions are further broken down by intervention type. We also have, so now this would be moving along in the Excel spreadsheet, but I've just broken it up so it's a little easier for you to see. The summary tells who made the announcement for the intervention, and we give more detail here than you'll get in that short description that's in the timeline. We have the primary source. So this could be a media release, a government website, an Indigenous organization, a health regulatory body. So we've gone with very like high level quality sources. And then we also have a secondary source can often be a media. So it's like something in the more mainstream media. And we often use that to help us finding dates. And also, I should mention, we sometimes populate the effective until date, but often there wasn't anything in the announcements about how long this would be effective for. Then we have the level. So this can be provincial, territorial, or it could be a regional level if the announcement was made at the provincial and territorial level about something that was happening in a health region. And then we have whether the intervention pertains to an Indigenous population group. So that's the scan. Currently, we're at over 2,000 interventions and it's growing. The scan that I'm working on right now, we are looking at data up until January the 13th. So there's been quite a bit, you know, there's a lot happening right now in particular. And I also just wanted to touch a little bit on the process that we've gone through to collect this information, because we've tried really hard to be systematic and to, you know, create something that's comparable. So we've been updating the scan every 6 to 8 weeks. The first phase is the planning phase. So here we start by updating our instruction document. This is where we really brainstorm what, you know, is going on in current events that might affect our scan. So for the current scan, vaccines. There's so much that's going on in terms of vaccines. So we had to think about how to scope and categorize the vaccine category. Then we move into the scanning phase. This is the most labor intensive, where we actually do the work of collecting the data. And here we often encounter challenges working out what should be in scope and thinking about how to categorize things in ways that are really intuitive for our end users. And it's important that we document everything we do because we're trying to be consistent across the provinces and territories. And we have a large enough team that's doing this work that we have to make sure that this is documented so everyone can be consistent. In the quality assurance phase, other team members fact-checked someone else's jurisdictional files, and we're looking for consistency in language and consistency in the type of information that's been captured. And then finally, we take the entire scan and we pass it off to our copy editors and our translators, who have the monumental task of translating this all into French. And we also give it to the timeline team who prepared the files for the web. So that's those are our tools, and that's our process. And now I'm going to pass this over to Olga. And Olga, I'll just keep advancing the slides for you, and she's going to tell you about the application that she's been working on of this work.
Thanks, Christina, and hello, everyone. So as Christina mentioned, I will share with you one of the applications of the intervention scan, and we'll show you how it can inform epidemic modeling. So I will give you an overview of our COVID-19 health system capacity planning tool, which uses the intervention scan to determine the dates when public health interventions took place. So first of all, we started developing this tool again back in March, and we were hoping to help support decision makers in government and in hospitals in planning their response to COVID-19 pandemic. And since that time, our tool actually underwent a number of iterations and improvements. So what the tool allows the user to do is it allows to create a number of what-if scenarios and explore different approaches to managing outbreaks. And given a set of parameters for viral dynamics and for healthcare resources, it uses epidemiological modeling to predict a number of indicators. So it allows to kind of forecast expected number of COVID cases per day. It allows to see how long epidemic waves might be and their severity, the number of patients that are using acute care beds per day, when hospital capacity will be exceeded and by how much, and the number of healthcare workers that will be needed to deal with the increased demand and the PPE that they would use. So we worked with our stakeholders and experts to design the tool so it can be easily customizable to their jurisdiction. So what's happening? So like in this tool, we have over 40 parameters that can be adjusted to reflect local transmission and healthcare resources. We also wanted to implement this tool in Excel, so it's very easy. It's very easy to use by anybody who actually has Excel, and they don't need an extra extra software, or they don't need to log in into the web server. So, and that has been really appreciated by our customers. So, and our hope is that this tool can be used as a learning tool to better understand how public health policies and interventions affect the epidemic trajectory and demand for healthcare resources. Just to give you the brief overview, so next slide, please. Thank you. So, so our tool has 3 interrelated modules. So first of all, first module is epidemiological module, which lets you use historical data and public intervention records to project different epidemic outcomes. The capacity module uses epidemiology projections to predict how many hospital beds and ventilators might be needed. And then the last one, like the third module, is health worker or PPE module, which predicts the number of additional staff and supplies that might be needed based on user supplied staffing ratio and PPE burnout rates. So I will just briefly describe each of those modules so that you're familiar with them. So we'll start with to highlight some features of the EPI module. So the EPI module lets the user enter their historical case counts for their region or jurisdiction and the date of public control measures, such as school and business closure or openings. It then uses the discrete time SAR model to estimate community spread and predict case counts based on the reproductive rate at the time of each intervention measure. Next one. So, and as Christina showed, so here is where we start using the intervention scan. So based on the intervention scan, the user can discover their local intervention dates and enter them into our planning tool. Next one. Yeah, sorry. Yeah. So those are the dates and potential changes in the transmission occurred. So, so the users can use Excel solver to estimate the effect of these measures on the reproductive number or transmission. So the closeness of fit of the model is shown by the overlap of the blue and orange line. So the blue line is the case count projected by the model, and the orange being real historical data. And you also can see that there is like thin dashed line, and it shows estimated change in reproductive number or R effective. So when projected and observed data matched, the R effective for each given date is accurate, and so the user can judge the impact of the public health measures on the virus transmission. Next one. So what the user end up is with a visual depiction of the combination of dates and interventions, real life case counts, and model predictions. So the EPI module also has a feature to let user to include importation cases, like so people who were some infections that actually came from outside of the jurisdictions. As well, it has the opportunity to include super spreaders, and we know that they create like a larger number of infectious individuals in the community. Sorry, next one. So the EPI module ultimately outputs an infection curve along as estimated size of the outbreak, its length and severity, and can predict the timing and the size of the peak of the next wave based on the scenario. So Christina, can you advance the slide, please? Okay, so capacity, so capacity module. So the capacity module translates the predicted case counts into projected demand for acute care beds in the hospital system. So the user can input parameters such as the current health system capacity and use, percentage of the infected population hospitalized and in need of ICU, their length of stay, and fatality rates for the COVID inpatient population. And what they will see, sorry, next slide. Yes, so this will allow to build a scenario for hospital resource utilization. The user can see what will be the demand for the non-critical care beds, ward beds, or ICU beds, or ventilator use. The module also outputs, in the next slide, So the module also outputs the peak resource demand for the upcoming epidemic wave, including whether and when the resource capacity will be reached and by how much. So in this scenario, looks really nice, like there's a capacity is not reached, but it also can show if the capacity is reached, like, and the user can build that scenario as well. So on the next page, the next slide, we can see that the user, using those two modules, they can build and graphically compare up to 6 scenarios. And those can show how changes in reproductive rate because of public health measures and varying hospital capacity can affect both the infection curve and resource shortfalls. And the third module on the next slide is the PPE module, which uses the predicted number of patients based on the infection rates and hospitalization rates to estimate demand for staff and PPE equipment caused by the epidemic. So in this module, the user can enter parameters such as patient to staff ratio or shift lengths, burn rate for PPE such as gloves, masks, gowns for each patient or each staff member. And on the next slide, you will see the output from that module. It outputs monthly breakdowns of the number of COVID patients that will require treatment and the average and maximum number of access staff that will be needed to care for those active patients that month. And we included nurses, physicians, respiratory therapists, cleaning staff, etc. And it also provides a weekly breakdown of expected PPE use by those staff members in treating COVID patients in the hospital. And on the next slide, I just wanted to conclude with just give you an overview how this tool has been used so far and who was using it. So we've rolled out the tool to over 40 clients in provincial and territorial government ministries, regional health authorities, public health units, and hospital facilities. And so far, feedback has been very, very positive. Particularly, we heard from stakeholders, and they really like how easy this tool is to use, it's how flexible it is, transparency in the tool and the model itself, and how quickly they can build different scenarios and compare them. And we're also very happy to work with our stakeholders, and if they have questions or need guidance or they need some help with building those scenarios, we always are there to help them. And just this kind of concludes our presentation. I just want to thank you for your time. And before I open the floor for questions, just want to leave you with some links to both of those tools that we highlighted today, as well as some links to CIHI COVID-19 page, which also has some other resources if you're interested. And if you would like to reach out to us, like, you can always email us at help@cihi.ca, and we'll be happy to hear from you. But yeah, let's open the floor for questions.
Thank you so much. So we do have some questions right now in the chat. So we have about 7 minutes, so maybe we'll get started to read them. So the first one is from Ian Mitchell. And the question is, what validation was done on the model and separately in brackets on the implementation in Excel?
Right. So we've done a number of comparison and validation from external tools. So on our SAR model, I can basically add the curve. Like, so we've done the validation on some models from PHAC, and as well as there was a model in McMaster University, so we compared them, and our model was performing as well. So, and we also, the best validation also, like, is based on the data. So we can fit the observed data very nicely as well. So, like, that's our validation.
And Dr. Catley, would you like to add, or I can go on to the next question? Good, perfect. Okay, so, and excuse me, Emily, I didn't see your question before, but Emily Marshall asks, curious what variables you wish you could have included that may have not been available yet.
Sorry, say it.
Do you want me to repeat the question?
Yes, please.
Yes, so the question is, curious what variables you wish you could have included that may not have been available yet.
Right, so there's a number of variables that we've included, but there's like not direct, you know, there's still kind of not exact understanding of what the proportion, for example, of asymptomatic cases is, right? So there's a number of variables that we included that as still kind of questionable of what really the exact number is. But what we also would want to include probably, if we would know the new, we have a new virus, like, I mean, this is absolutely a new virus, right? COVID-19 is a new virus. Like our reproductive number at the beginning, it's like the best of our estimates. And we know that there's new mutations. So like we would like to know, like, if there is some new mutations of the virus, like how different it is from the ones that already started, right? Like, and we know that it's spreading much faster than the first variant. So that's something also that we would like to include, but now we are considering also including vaccination in our model. And so definitely it's always a development and inclusion of new information, and we're just trying to catch up with the reality. And sorry, like I just want to get back to the first question about the validation. We also validated the model on using just historical data, like just, like if you use just 3 months of the data and see if we can predict well for the next 3 months. And that was also our validation. So that's, just wanted to add to that question. Sorry, brain sometimes work backwards.
And Dr. Catley, would you like to add, or I can go into the next question? Whatever you like.
Go ahead.
Oh, perfect. Okay.
Too much.
So the next question is from Steve Slade, sorry. And it is, how cautious or not cautious should one be in saying, if you implement these measures, you will experience these outcomes regarding infection, hospitalization, ICU surge, etc.?
I guess it's back to the modeling
it's you, Olga.
Yes, I think that you have to be very cautious, because it's very hard to really say that specifically that intervention or specifically that, for example, school closure actually would lead, or business closure would lead to reduction in R0 by so much, because there is so many different variables that come into effect when looking into the transmission of the virus. There is also we don't know also how the weather affecting it, like there is, you cannot really dissect the effect of one intervention onto the transmission, like it's best to our knowledge that actually, yes, there is some correlation. We actually just see that, for example, specific business closure has a reduction of R0 on so much, but it doesn't really, it's really hard to say that for the next time when the government implements that measure, you will have exactly the same effect. There is, just going back to the question about like the, for example, age actually plays a really important role, and like the waves are very different. That number of people who were infected, proportion of people who were hospitalized in the first wave is actually very different from the second wave. So it's there is what I just want. Sorry. So what I just want to say that there's a lot of different things that actually affect hospitalization rates. So like we can't really dissect and say that there's like only one intervention that actually would make that that drop in the transmission or that rise in the transmission.
Okay, and we have our last question. It's from Michael Wolfson, and it's for the rates of infection. What kind of sub model are you using? Sub in brackets. Is it a CEIR compartment model? Is it a R0 or a ref, an output or an input? Thanks. That's the question.
Thank you, Michael, for the question. Yes, so we're using compartmental model. So it's a differential equation model, but we translated it to the discrete equation model. So it's SAR, and R0 is used as an basically input, but then because you don't really know the exact R0 at specific dates, so it's used as an input, but we use the solver, Excel solver, to get the best fit for the model, and you can actually the calibrate the R0 parameters. So it's calibrated in the model itself, like, and people can calibrate it in Excel. So they have a kind of a good estimates of R0. So I hope this helps with the question.
So, no, that was perfect. Thank you so much to you both. So on behalf of the CanCOVID team and network, we'd like to thank you for your time to present to us on such an important and great tool. It seems like there's like a lot of work that was been done since March, and it's amazing to see. And so I'm looking forward to actually going through it and using it. So just to provide a bit of an announcement for next week's speaker series, we are going to have two students, Farah Quasar and Justine Mendolia, who are part of the Chiefs, sorry, let me get the correct saying. So they're part of the Chief Science Advisors Youth Council, and they're going to be presenting to us on an interesting topic, which is, just get that for you in just a second. On the COVID-19's impact on Canada's next generation of scientists and professionals serves in the Canadian Chief Science Advisors Youth Council. So that's the title, and we're looking forward to this presentation. They're very bright students, and I got the pleasure to meet them. So hopefully you guys can all join next week on January 26th. So thanks again, everyone. Have a good evening.